at a suitable premise until they return a negative result. This approach is consistent with what we put in place initially in mid-December at the beginning of the Northern Beaches outbreak in New South Wales. I hope this additional testing regime is all we have to do, but I will do whatever it takes to keep Western Australia safe, and we won't hesitate to put in place additional border controls if that is what the health advice recommends. For those who have visited an exposure site, as is currently the case, they must go into 14 days of self-quarantine and undergo testing on day 2 and day 11. People coming from Victoria entering Western Australia must continue wearing their masks from the airport to be tested until they return a negative test result. Land arrivals must also wear masks upon entry into WA until they return a negative test result. In addition, arrivals cannot use public transport until they have returned a negative test result. At this stage, those who have arrived in WA from Victoria between May 15 and May 25 prior to 6 p.m. will be contacted by West Australian Police via the G2G Pass system with the latest advice regarding the exposure locations in Victoria. It is important to note that around 18,000 people have arrived in WA from Victoria since May 15. We have this information and the contact details of each arrival because of the G2G Pass system in place under our controlled border arrangement. Anyone who is unwell or experiencing symptoms should immediately get tested, especially if they have been in Victoria. We will continue to monitor the situation closely over coming hours and days to determine whether we need to take further action under our controlled border regime. These instructions may change if the situation deteriorates and we received updated health advice. This is a concerning and disruptive situation, and given the impact on the nation and the experience of Victorians last year, we hope they bring this outbreak back under control as soon as possible. We thank West Australians and affected travellers for their understanding. However, the government I lead will take whatever action is required to keep our state safe. As this pandemic continues, it's a timely reminder of the importance of following the health advice, keeping good hygiene practices, getting tested and staying home when you are unwell, and now getting vaccinated when your turn comes. Eligible West Australians can now book their vaccinations online by going to rollupforwa.com.au. If you don't feel comfortable booking online, you can still call 13 COVID to make a booking or talk to a participating general practitioner. I encourage every eligible West Australian to get vaccinated as soon as possible, as it is the best way to keep your fellow West Australians safe. Since the online booking system went up yesterday, around 3,000 new registrations have taken place, which is very encouraging. I hope to see that number continue to grow as more of us do the right thing and roll up for WA. Are there any questions?
So is this essentially Victoria regarded as a medium risk state now?
No. Medium risk is essentially, medium risk would mean none coming in. So what this is if you are in Victoria as of 6 o'clock tonight, if you want to come to Western Australia, you must be tested and you must quarantine until you get a negative result. That's what we're putting in place. This is consistent with what we did with New South Wales when the Northern Beaches outbreak started on December 17 last year. What then happened in New South Wales is the outbreak obviously spread. It went over New South Wales. They had rolling lockdowns for months on end, and we went to a harder border arrangement. So we'll monitor what's happened in Victoria over coming hours and days to see if we need to toughen the arrangement, or indeed, if they get it under control, there's no further cases, we may be able to soften the arrangement. But this is the arrangement we have put in place based upon health advice we received today.
Why don't you backdate the testing to the 15th, given that there's 18,000 people?
Well, it's a massive exercise. We received health advice on this, and basically we are going to use the GTG Pass system to contact everyone, as we have done before, to request that if they are unwell, they should get tested. That means also that all those people who have been to any of the exposure sites, they must get tested and quarantine for 14 days. So this is consistent with arrangements we've put in place before.
If there are more people that test positive, will those 18,000 people then potentially have to test?
Well, we'll take health advice on that, but certainly we'll monitor Victoria very closely, as indeed the whole country will over coming days, to see what happens. What's very concerning about this is the gentleman who acquired it in hotel quarantine in Adelaide has been in Victoria now, I think, for about 10 days. So obviously there's now 9 cases. If that case number grows, we may well have to go to a higher level of restrictions on Victoria. But at this point in time, it's still pretty tough. I mean, if you arrive from Victoria from 6 o'clock tonight, and there's flights coming in tonight, those people will need to quarantine and get tested, and until they get a negative test result, they won't be able to leave quarantine under the law. So, as I said, that's consistent with what we did in New South Wales in December of last year.
The Essendon football team are playing at Optus Stadium on Saturday, so they're going to be like everyone else, quarantined until they test negative.
That's right. So we've advised them. I think they'll be arriving on Thursday. We'll get a test regime in place, and they'll have to test negative before such time as they can come out of quarantine.
And if they do return negative test results, are you happy for a sellout of the stadium to go ahead and say?
Well, that's the advice at this point in time. Obviously, if things change in the next few days, that may well change, but at this point in time, that's the advice.
Are you aware of anyone who's been to one of the exposure sites who's now in WA?
Not that I'm aware of. Thank you.
On the rally today, the nurses, many of them quite young, they really displayed absolute anger at their pleas for extra resources not being responded to by the executive for months and months. They say that they no longer have confidence in the chief executive. Really keep it so.
Look, I understand the emotion. It's a very emotional issue. We're dealing with the death of a little girl and a family that is grieving. And we're dealing with a workforce that, like all the workforces in health across Australia, is under pressure. We have provided additional resources. As I outlined today, and the Minister outlined today, we'll continue to provide additional resources. So we're recruiting 1,000 new nurses this year, 1,000 new nurses next year. We're putting in place additional beds, both in emergency departments and across hospitals all over the state. And over time, and in fact currently, we're rebuilding hospitals all over the state. This is it's a very sad and emotional situation. Just urge everyone to be understanding that there is a family involved here that is grieving, and we need to be very, very aware of their feelings and make sure that we do everything possible to find out exactly what happened, so we can get answers and do our best to prevent it from occurring again.
Many of those we spoke to say they don't believe the concerns they raised were escalated to ministerial or government level by the executive. They want the chief executive gone. Will you move from that?
Chief executive of?
Anyway.
Yeah, no. He is highly regarded in health. He is, I think you've seen him in public. He is a very capable person. And we'll just do our best to get to the bottom of what's occurred and make sure that we can do our best to prevent what occurred from occurring again.
Thanks, everyone.
There is a Qantas plane on the tarmac.
Yeah.
And
No, well, the directions kick in at 6 o'clock tonight. So we have to get them drafted, we have to get them issued, we have to do all that work, and they start at 6 o'clock tonight. Thanks very much.